I think global health is kind of an interesting part of healthcare because it kind of falls in between a lot of different sectors. There's a pretty large international development community here at the GSB. There's also a huge international development community, I think, at the university, kind of at the broader university, and a global health contingent over at the medical school. So I think if you're interested in global health, there's a ton of resources at the GSB, but there's a great amount of other people and programs and talks and classes that you can take across the street where people have a ton of experience in this space. Other opportunities to kind of explore healthcare at the GSB are through these global trips that are offered every year. They're literally like 20 or 30 trips offered all around the world, and every year they're different in terms of where students go, and they're all student-led and initiated. So I had the opportunity to go to Cambodia and Thailand as a first year, and then lead a trip to India as a second year, and in both, healthcare was one portion of kind of what the trip focused on, to look at the differences between how healthcare is delivered in a developing country versus the US. And it was incredibly impressive to see the innovations that took place there in terms of low waiting times, high quality outcomes, a range of services provided at different price points. Just a lot of inspiring kind of healthcare delivery systems in these countries that definitely could be brought back to the US in terms of how we think about delivering healthcare, particularly post-reform as we move forward.
So at GSB, you also get immersed in these global exchange and experience programs where students travel to a different country and in that country get immersed in many different areas. One of them is healthcare. And a lot of friends of mine and I, we traveled to India, and the focus at the trip on some parts were about healthcare. And it was a great experience to learn about the challenges faced by people in the healthcare systems in other parts of the world, and the interesting ways that those people are trying to solve those problems.
So the global study trips tend to be roughly 35 students and 4 leaders, 4 to 5 leaders, I think, second years. Most of all the trips are completely student. They're put together by the students and designed by the students. So a lot of times you have students that are coming from those countries that craft an entire experience around the country that they came from, because they're very proud to kind of show their heritage and what the business community is like in those countries. And the trips tend to be for roughly, I think, 8 to 10 days, depending if you go over a winter or spring break. Cover 2 to 3 cities each. And it's a really incredible experience to travel with your classmates, as well as people that are actually from those countries and see the countries through their eyes.
We met with for-profit companies and not-for-profit companies, international companies and homegrown companies, and it was just wonderful to see what India is doing in healthcare and how resourceful people are there, and how a lot of the solutions can't be transplanted from one culture to another.
And it's good because it gives us a chance to learn about how people are thinking about very similar problems that we're faced here in other parts of the world, and also create this information exchange where we can tell them what we're doing here, and we can also learn from that and bring it back to Stanford and bring it back to the wider community, and hopefully give somebody an idea here that started, let's say, in India or in China or in Russia, and then use that to solve the problems that are unique to our system, but can be solved similarly to other countries.
So one of my favorite things about that trip was meeting a rural healthcare worker. So she was this woman that had never finished elementary school and was a villager, and she signed up and recruited for being trained as a rural healthcare worker. And so she got very basic level training, way less than any nurse would get. But in her village, she became the source of knowledge of how to deal with kids that have diarrhea, and she would take care of pregnant women and newborns, and her village all of a sudden was healthier. There were a lot less kids dying from simple things like diarrhea, and there was a lot less maternal mortality and infant mortality, because there's very, very basic things that you can do to prevent these deaths. And this woman had been at it for about 10 years, and she had become kind of higher status in her village because she had this little bit of knowledge and she was helping everybody there. And so it really, again, came down to the fact that it's about the people that you're caring for. And I don't think I would have ever gotten to meet somebody like that if it wasn't for the GSB. So that trip was great, both because we went with the huge hospitals and the amazing med schools that there are in India, but also we got down to the village level. So that was great.